Hello and thank you for joining us this Friday evening. This time 4 years ago, the country was in the middle of a global pandemic and about to go into the first COVID lockdown. Today, while life has returned to normal for many, there are still those living with the devastating consequences of the virus. Latest figures estimate that 1 in 143 people in England were infected with COVID-19 on the 6th of March this year. Those infected between November and February face a 1 in 224 chance of being hospitalised, although that risk varied with age. It's more difficult to know how many people are infected with long COVID, as the last official statistics were published a year ago. At that time, an estimated 1.9 million people in the UK were experiencing symptoms more than 4 weeks after infection. Our health correspondent Jamie Coulson has been to meet 2 patients whose lives have been changed by long-lasting symptoms of COVID.
Long COVID, I think, is an invisible illness. If I wasn't wearing the sunglasses because of the light intolerance and I wasn't wearing the mask, I'd look pretty normal. But I'm just so far from what my normal used to be.
Mike first caught COVID in October 2020 and then again in September 2022. Both infections caused catastrophic long-lasting symptoms that include extreme fatigue, brain fog, breathlessness, pain and hearing loss. There are times when the once active 61-year-old can be bedbound for up to 20 hours a day.
My world has shrunk. So I used to travel a lot with work, I used to travel a lot with I would dance 12, 15 hours a week, did a lot of hill walking and fell walking. I loved being in the hills. And my world has shrunk literally from the world to this house.
It's difficult to know exactly how many people are living with long COVID, as the Office for National Statistics stopped publishing data a year ago. However, NHS statistics show there were more than 1,500 new referrals to long COVID clinics in England in January alone. Professor Stephen Griffin is a virologist at the University of Leeds.
You can develop long COVID after any sort of severity of COVID infection. So we are still pretty much at the same level of risk as we were in terms of the number of cases that we're seeing. Our individual chance of developing long COVID has reduced because of vaccination, but the sheer scale of SARS-CoV-2 infections in the country still means that we're seeing, we estimate, somewhere around 1 or 2 million people suffering from this condition even now.
If I were going to die, they had to resuscitate me twice, and then you see people dying around you, wondering if you're going to wake up the next day.
Kelly Day spent 31 days in hospital with COVID, 11 of which were in intensive care. More than 3 years later, she still struggles with a range of debilitating symptoms, but feels there isn't much understanding.
People say, you look well, but they don't know what's going on inside, and mentally as well. It's just been forgotten about, do you know what I mean? And they just think, I've got long COVID, it's just an excuse. Do you know what I mean? But there's a lot of people suffering.
Both Kelly and Mike have received support from long COVID clinics, but the direction of their lives has been completely changed. Jamie Coulson, BBC Look North.
Well, earlier I spoke to Dr. John Wright, who is the director of the Bradford Institute of Health Research, which has looked at some of the wider impacts of the pandemic on society. I began by asking him about the impact of long COVID.
You can listen to Mike and Kelly's stories. I mean, that's very typical for severe long COVID patients. They say how it just turns their lives upside down. They become shadows of what they were.
And you've been looking at the wider impact on society in your research. What have been your most worrying findings?
Yeah, thanks to the thousands of families in our Born in Bradford study, we've been really at the forefront of researching COVID and understanding its impact, understanding the risk factors for long COVID. And our attention really is turning to the children and young people now. And what we're finding is, if you were born during the pandemic, for example, children are slow in meeting their developmental speech milestones. They're getting more anxious as toddlers. They're not, struggling to interact with other children. And the teenagers are having this epidemic of anxiety and depression and sadly loneliness.
And what lessons have been learnt?
So we've got a big national COVID inquiry going on at the moment. Many lessons will be learned, But I think the key one is how unequal our country has become. We live in one of the most unequal countries in the world, and I think it's the poorest who have really suffered, who've had the most infection, the most deaths, the highest risk of long COVID, and the most financial impacts following the pandemic.
As we can see, it's still affecting people's lives, but there are many people out there who say the pandemic is behind us. What's your view on that?
Well, it feels like a lifetime ago, doesn't it? It feels like a different world. But the consequences, we're going to get the shock waves for many years to come. In the NHS, we've got waiting lists up to 8 million. And when we see, when we work with the schools, we realise how that educational loss during the pandemic is really playing out into long-term effects on the children.
And of course, you were there on those COVID wards in the height of the pandemic. What are your abiding memories?
Well, this time 4 years ago was, why the hell is the government not having lockdown earlier? But and then we had all the sort of chaos of PPE and things like that. I think my abiding memory is our resilience, both in the NHS, how we pulled together, how innovative and creative we were. And I think we across society, actually.
Yeah, we learned a lot, Dr. John Wright. Thank you for your time this evening.
Pleasure.